I also want to talk to you about Laura. Laura, very much like Judy, had the same sets of things going on in a lot of ways. They were unrelated to dental issues, at least what I typically looked at coming out of dental school. Laura also had some very far-reaching things, and as it turns out, Laura had herself on a path that was going to be ugly. Because of comprehensive diagnosis, because of allowing her to select what was right for her, there were some things that were done for her that are absolutely astounding, not the kinds of things that as dentists we're supposed to be able to fix. And yet, it's the kinds of things that as dentists we should be able to fix every single day. In my office, one of the things that we did was when we had our morning huddles, we didn't just read the schedule. I mean, obviously we go through the schedule, but that's very quick and very easy. I don't need my team to read the schedule to me. I don't need to read the schedule to my team. What we looked at in my office is what patient that day is going to thank us for what we've done. What patient that day is going to hug us. What patient that day might cry. Because we've changed the quality of their life. We've changed the direction that their life is going. What patient do we have coming in today that's going to be so excited about what dentistry did that they might break into tears? Now, if you know who that is, and you have that patient on your schedule, and you have one each and every day, dentistry is never anything but fun. And that's the way that it should be practiced. Laura is exactly that kind of a patient, and you all are going to have patients like this. And you look at Laura, it's, a really nice lady. She had issues with chronic headaches and bruxism since 1997, which at that point had been 10 years or so. Now, one of the things that she had been dealing with is that she's easily tired. We know chronic fatigue syndrome, Epstein-Barr virus, we're reaching with medical diagnoses that in some cases are sort of, without being crass or throwing stones at our physician colleagues, they're sort of a garbage can diagnosis. Here's a list of symptoms, and here's something that you kind of fit. Based on your list of symptoms, here's the issue that you might have. Well, that may be very adequate, but maybe it isn't. In this case, I think probably it wasn't. Now, she was having to sleep sitting up because she couldn't sleep laying down flat. Not a dental problem, obviously, because we work on teeth, but it is something that had come out in her health history. And these aren't dental medications, Paxil, Lithobit, lithium. Those aren't medicines that a dentist would typically prescribe. So they're just on her health history, and we were, for all intents and purposes, kind of taught to ignore that. When you look a little deeper at what's going on in her case, there is, over a period of about 10 years, some dramatic changes, dramatic differences. If you look at what happens in her mouth, that line that you see on that photo from just 10 short years ago turns out to be pretty important. When you look at that line, that's where she had ground her teeth off to. There was something going on. Something dramatic was happening in her mouth, and she was destroying her teeth. Over a period of a decade, she'd ground off nearly half of her clinical crown. That's frightening. What does she get? She's so young. What's she going to do a decade from now? So we want to take a look at what can be done for a patient like this. Now, obviously, if you picture her teeth closing together, she hits bilateral simultaneous. She has good occlusion, at least on a microocclusion level. But what's causing that bruxism, that wear, that tear, that grinding? What's causing that destruction of tooth structure? That's not from how she brushes her teeth, and that's not from using toothpaste. That's from something else that's going on. It's from a parafunctional issue that needs to be addressed. So when you look at the treatment choices that she had, it's going to be the same kinds of things that you see in every one of your patients. You could continue to do nothing. 10 years from now, she'll be 10 years worse. But doing nothing would obviously be a choice. You could put her into an orthotic, and using an orthotic or a splint to redesign how the upper and lower jaws fit, you could put her into a physiologic position that's more comfortable as long as she has the orthotic in. And so what we want to decide is that what's right for her? Well, it's not really up to me. It's up to her. It's up to Laura. That's the patient. That's the patient's choice. What makes most sense for them is not up to the doctor. Our job is to educate them on what kinds of things can be done and keep them from making a bad decision. But our job is also to tell them what's possible and to allow them to make a good decision. If we can make a good, comprehensive, quality care decision and get her into a lifestyle situation that is better for her, that improves her quality of life, that's a good day at the office. And so she could absolutely use an orthotic. Certainly we're going to start with the orthotic first, because you would never change a patient's bite from what it is to anything else without first using an orthotic to test drive it. You make reversible temporary changes, prove first that they're right, and then you can look at how you're going to design long-term changes. So you could use that orthotic short-term, you could use that orthotic long-term. She'd be married to it. It'd be like having a bad knee and you have to wear a knee brace. And now she has to wear the knee brace everywhere she goes so she doesn't blow out her knee again. Well, she has to wear the orthotic everywhere she goes. She has to wear the orthotic when she eats, when she sleeps, when she talks, when she does everything that she does, because it's what supports function. But certainly she could use the orthotic long term, and I've had many patients who do. It helps them, and so it's a useful tool. Now, orthodontically, you could fix those teeth so that they fill in that gap. They restore her bite to what's proper for her. That's absolutely an option, and if she did that, then she would be able to get functional gains. However, because of the destruction of tooth structure in her mouth, she wouldn't get any cosmetic gains. As a matter of fact, it'd make things look worse. But it's an option. Orthodontically move the teeth to neuromuscular position, but it doesn't change anything about the appearance. Another thing that she could do is a full-on neuromuscular rehab. And there she would end up going in and restoring both the shape of the teeth, but then also the fit and the function of the teeth. And in Laura's case, that's what she picked. Restored the function, restored the cosmetics, restored her mouth so that she was able to design her teeth so that things work the way that they're supposed to. So in Laura's case, she chose neuromuscular rehab because it addresses all of her needs, not just the function, but also the aesthetics. And so when you take a look at where she was before and how decimated her dentition was and where she ended up after, it's obviously a big cosmetic change. But that's not the really important thing, although it's nice to take a patient from worn down, unaesthetic, unattractive teeth and put them into something that they really enjoy having, that they love to show off. That's fantastic. It's a joy to be able to do that as a dentist, but that's not really what this case is about. You look at a case like this, you got rid of her headaches. The chronic headaches that she'd had since 1997 disappeared because her mouth was put in a relationship that was physiologically correct. Improved the posture of her head, of her neck, of her body, of her shoulders. It eliminated the bruxism. The thing that we were taught, well, that I was taught in dental school is idiopathic and unfixable. We fixed it. It's fixed using neuromuscular dentistry. When you restore a patient's physiology so that it is comfortable, then the muscles no longer have to scratch and itch. The muscles are no longer looking for a better place to rest, and so the muscles will stop grinding. You get rid of the bruxism because you don't have any reason for the muscles to try and grind that tooth structure out of the way. That's what Laura was doing. She was trying to remove the tooth structure that was keeping her out of the proper bite. Well, we get rid of that by restoring that patient to the proper neuromuscular position and got rid of the muscle fatigue. The chronic fatigue that she was dealing with, the sleeping issues that she had, the medication that she was on, all of those things got better. So when you're looking at what we can do for patients, it's big. It's way bigger than just helping get your patients into prettier teeth, and it's way bigger than helping to get your patients into teeth that don't have cavities in them or weak spots or opalescent highlights or fluorosis. It's not about making the rotation a little bit less of an issue cosmetically. It's about fixing it functionally. It's about restoring proper function, proper physiology to your patients. So one of the things to remember is, and this was a tough lesson for me when I was coming out of dental school, but it's not about me. It's not about what I can do for my patients. It's not about how great of a dentist I am or how great my new material is or how great my impressions are. And all that stuff is important. It's absolutely critical. You have to be a capable, competent clinical dentist. You have to be able to do things well. But it's not about you. One of the other things that we need to remember is that not everybody cares. You look at what amazing things we can do for our patients, and not every patient wants or needs that. Matter of fact, there are lots of patients, in practicing in Oklahoma, we had patients who were out on a farm all day long, and they would talk to their cows, they would ride in their tractor, and they didn't need to have teeth. They would get along just fine. I had patients that would eat steak or corn on the cob and didn't have any teeth at all. You have the patients that would wear one set of teeth to church and another set of teeth to eat. And you have lots of patients that didn't wear some or all of their prosthetics. So not everybody cares about having the ideal set of teeth that I would like to have. Not everybody cares about how great of a dentist I am or what great new things I know how to do. And of course, not everybody can get all this stuff done for a number of reasons. Maybe they're not healthy enough already, or maybe they don't have the funding to be able to afford the ideal dentistry. And it's unfortunate, but it's okay. Because what our job isn't to provide every patient that walks through our door with excellence in dentistry. Our job is to be excellent as dentists for every patient that walks through. If that patient decides to move forward in treatment, then you do the absolute best job that you can, and your best should get better every single year. But we don't have to treat every patient. We don't have to treat every person. Just because they come into our office doesn't mean that we have to accept them as patients. Neither do they have to accept us as their dentist. And then not everybody should. There are patients who are just fine where they are. You'll have, looking at the numbers, you'll have patients that will walk into your office, and of adults who grew up in a civilized society, North America, Western diets, Western culture, living in houses with carpets, using Lysol on everything in the world to protect us from the evils of bacteria, we end up with responses. Our body responds to that. Through the eons, we didn't have Lysol, we didn't have carpets, and we didn't have McDonald's. And what's happened is recently we have changed that, and our bodies are adapting to it. So you're going to have a lot of patients that are going to come into your office with some issues that are relatively new. When you look at what's going on with those patients, it's our job to help them to explore it. But it's up to them whether or not they move forward. And not every patient will, and that's okay. Your job is to offer them the opportunity to have the best of the dentistry you can provide. Their job is to decide what's right for them. Now, if your patient's making a bad choice, they say, I want you to pull my teeth out and fit me with a set of clackers because I don't want to floss my teeth anymore. Well, if they've got good teeth and good bone holding their teeth in, it's probably malpractice to take those teeth out. So you have to obviously temper what the patient's wants are with what their needs are. But it's not true that every patient will do exactly what you want them to do just because you say so. So understand that going into it, and it's okay. It's okay for a patient to say no. It's okay for a patient to say, no, not right now. It's okay for a patient to say, no, not ever. Your job is still to offer them the absolute best that you can provide. And then as a dentist, as a professional, your job is to change your level of best so that every year it's better than what you did last year. That's what keeps dentistry fun. That's what makes it exciting. That's what makes you a better dentist and a better person. Makes you a better leader in your office, in your family, and in your towns. Because you're dedicated to excellence. That will spill over to everybody else whose lives you touch. And that's where you want to be as a dentist. What it comes down to is everybody deserves to know. Every one of your patients deserves to know what dentistry can do for them. They deserve to know. They're coming to you because they expect you to tell them. It's not that they maybe want to talk about what dentistry can do for them. They expect you to tell them. If you went into your physician's office and you didn't hear from them the things that were sick in you, wouldn't you be bothered by that? Patient comes into your office and you don't share with them the things that are sick in them, shouldn't they be bothered by that? Every patient deserves to know. And then after that, it's their choice. What's right for them? That's up to them. They're going to decide.